Hi, my name is Marjorie Scogin, and I'm a physician assistant with CHRISTUS Trinity Clinic. I was born in the Navy Hospital in Philadelphia. My father's military, so I grew up everywhere. I graduated from John Jay High School. My mom was a cafeteria there, lived there for about 30 years. And then I went to UTSA, and I'm ashamed to say it was only 4 buildings when I was there. It was that long ago. And now it's like a city. But now I have 2 boys, and they're road runners too, so they're keeping up the tradition. So I consider myself actually from Texas. I've done most of my healthcare here, most of my career here. So actually, I didn't start out in medicine. I started out in engineering. I did that for about 3 years, and then I found out it wasn't for me. But I'm kind of a nerdy girl. I like math, I like science. And then I ended up transitioning into medicine. So I get to follow up families. I've seen 3 generations of families in my care. I love urgent care because it's a quick fix. So I love to kind of make people feel better. But also there's that relationship with your patients that you don't sometimes get in other careers. So I find that very fulfilling for me as a person. It's what I'm motivated to do. Sometimes I'm a patient too. So I hope that I treat my patients the way that I want to be treated. Breaking things down into simple language so that people understand what their medical problems are, why they need to come in, even if they're feeling well. Sometimes your families give you good looks, they give you money, and sometimes they give you diabetes and high blood pressure. So you learn to manage what you're dealt. And I think that at the end of the day, I'm going to be on your team. I'm going to help you reach your goals. If you meet your goals, I'm going to celebrate with you. If we kind of fall short a bit, we're going to regroup and kind of take a different approach. But I always say there's not one way to treat a patient. And that's one of the things I love about patient care and about the career that I'm in. But my concern is that don't avoid those things. Learn how to manage them so that we can be healthy in the long run. And so I hope that I can bring that to the table when I see my patients.